Atlanta real estate agent Kenya Green says for 4 long years she suffered with tremendous pain and heavy bleeding during her menstrual cycles. She knew it wasn't normal, and when she asked her doctor to investigate, she was told fibroids were the culprit. Fibroids are typically non-cancerous, muscular tumors that grow in the wall of a woman's uterus. Very large fibroids can cause a woman's stomach to enlarge, making her look pregnant. According to the U.S. Department of Health and Human Services, up to 80% of women develop fibroids by the time they reach age 50. While not all women with fibroids have symptoms, those like Kenya who do say life is anything but normal.
When you have these issues of pain, you have these issues of heavy blood flow, it's almost like you are a prisoner. You know, I felt like a prisoner. The calendar was a very big deal to me because I would plan my life around my period.
Fibroids are most common in women in their 40s and 50s. Fibroids can grow as a single tumor, or there can be multiple fibroids. The tumors can be as small as an apple seed or as large as a grapefruit.
Each black circle that you see in these pictures are all fibroids, and they are collectively enlarging the uterus.
Dr. John Lipman at the Center for Image-Guided Medicine in Smyrna has treated Kenya Green and many other women with a non-surgical outpatient procedure called Uterine Fibroid Embolization, or UFE.
The take-home message is if you're suffering with fibroids and they tell you you only have surgical options, it's just not true. You can keep your uterus. It's important to keep your uterus. It's not just for childbearing. It has other important functions.
While the cause of fibroids is basically a mystery, there are several factors that increase a woman's chances for developing fibroids. They include age. Fibroids are more common in women during childbearing age. Family history. If a woman's mother has had fibroids, her chances of having them are higher than normal. Ethnic origin. African American women are more likely to have fibroids than white women. Obesity. Women who are overweight have a higher risk of fibroids. And diet. Eating a lot of red meat and ham has been linked with a higher risk of fibroids. Constance Barnett says a hysterectomy, which is a common treatment option for fibroids, was not the solution she wanted. She chose UFE and says the procedure was simple and painless.
I don't remember even having pain. I had actually told my job I'm going to be off for probably a week. But really, after like 2 days, I was like, you know what, I need to go back to work because nothing's wrong with me. So actually I did. I went back to work earlier.
UFE is a great procedure. It's an awesome procedure. So when I heard about it and I was a candidate, I was doing a happy dance because I was like, now I'm going to be able to live and be free.
So just how does UFE work? A thin tube is inserted into a woman's groin area through a small incision. Then tiny plastic or gel particles are injected through the tube and into the blood vessels attached to the fibroids. This cuts off the blood supply only to the fibroids, causing them to shrink and ultimately relieving a woman of her symptoms.